Hi, my name is Emily. I'm doing my second IV attempt for invasive therapy. Hi. So I'd come into the patient's room, wash my hands, introduce myself. I would check their ID band against MR, and I would check to make sure there's a doctor's order for an IV. When I'm putting in an IV, I want to make sure it does, as long as it doesn't have to be on their dominant side, in a place that's not going to kink. There hasn't been a mastectomy or any other reason that I shouldn't pick this spot. I'm going to explain the procedure to the patient while I'm doing it. So I'm going to find my spot with a tight tourniquet. I'm going to visualize it, use my hands to lightly tap it. They can squeeze their hand. You can use a hot pack to get the vein. After I've found it, I'm going to undo the tourniquet, and I'm going to wash the site. Using friction, I'm going to wash the area around the site. And then while that's drying, I will set up my supplies. I have a truck placed so that in case I have any spillage, it doesn't get on the patient's bed. I'm going to take my flush and I'm going to remove the air, and without touching the end to keep sterility, I'm going to fill the extension tubing with the water. Then I'm going to loosen the cap, set it back down in. I'm going to wash my hands and put my gloves on. I will retie the tourniquet tightly. Visualize where I'm going to put where my insertion site is going to be. I'm going to remove the cap, and then with the bevel up, like a race car, I am going to use my hand without touching the insertion site. I'm going to stabilize it, and at a 30-degree angle, I'm going to insert until I get flashback. When I get flashback, I'm going to remove the tourniquet, and then I'm going to lay it down, and I'm going to insert the catheter, And then I'm going to have the patient hold very still. And I'm going to secure it without touching the insertion site. And across the top, but not where the insertion site is. Then I'm going to take my tegaderm. And there's a slit right over the end of the hub and over the insertion site. And I'm going to put my 2x2 to maintain sterility. And I'm going to take my extension tubing and I'm going to put pressure above the site and stabilize the hub. And take the end off without compromising. I'm going to remove the needle, set that aside for now, and quickly attach that and then connect it. And I'm going to aspirate to make sure there's blood return, that I'm still in the vein. Then I'm going to put at least 2 mils of water into the vein, making sure that there is no pain while I'm doing that. Then I'm going to stabilize the connection, making sure it does not kink but does not occlude the area of insertion. This can be left there so that it doesn't irritate the patient's skin, but it may fall off. I will put this into the sharps container, which I will do in a second. And then I will clean up my supplies. And then I will chart on how many attempts I put in, who put the IV in, if there was any complications, what size, if any fluid was hung and started, and if the patient had any complications. And once that's charted, I will be watching for a removal order from the doctor, which I did find one. So it would be, after the next day or after they're done with their infusion, I would come into the room again, rewash my hands, make sure I have the right patient with identifiers, wash my hands, put on a new pair of gloves. This won't be here. So I'm going to explain to the patient that I'm going to remove their IV. So softly, I'm going to start removing. Carefully pulling away the Tegaderm. And before it comes off, I will open my gauze. And I have tape ready. Stabilizing the hub so it does not come out too early. Remove all tape. Have the, without putting any pressure, tell the patient I'm going to remove it. I will pull the catheter out and then apply pressure. I will check the catheter tip for any, to make sure that it's intact. I will hold pressure for at least 1 to 2 minutes. If this patient was on Coumadin, hold for 5 minutes and then try to make a pressure dressing to keep pressure. And then the IV has been removed. I would need to clean up my supplies. And then I would go chart on the removal, that the catheter was intact, what time it was removed, and if there was any complications. Thank you.